The other half of a couple, the man. All you need to know about male fertility. In the past, the woman was the sole focus of attention in couples where conception was delayed, and we knew very little about the male factor. Our understanding of the male reproductive system and the importance of male factors in fertility has advanced significantly over the last couple of decades. We now recognize that abnormalities in the male partner are the sole cause of infertility or delay in conception in about 20% of couples facing difficulty in conceiving. They are also an important contributing factor in another 20 to 40% of such couples. With lifestyle improvement, proper evaluation, and treatment, men can father natural pregnancies with their partners. There are two big differences between male and female reproductive functions. Number one is age. While the woman's fertility sharply declines with advancing age, the effects of age on men are much less distinct. Men can father children when into their 50s or even later. Number two, the number of sperms. Women are born with a fixed number of potential eggs, and this pool inexorably declines as age advances until it is functionally exhausted at menopause. Chances of pregnancy in a woman therefore continue to decline with lesser and lesser number of eggs remaining with advancing age. However, in men, the germ cells or spermatogonium continue to multiply and produce millions of sperms even into advancing age. Even in their 80s, men produce millions of sperms into the semen, although the count and quality of sperms reduces somewhat with advancing age. It is estimated that about 100 to 200 million sperms are produced each day during adult life, and more than 1 trillion sperms are produced during a normal reproductive lifespan of a man. These are staggering numbers, especially if you compare that on an average, a woman produces about 400 eggs during a whole normal reproductive lifespan. The process of formation of sperms from germ cells in the testes takes about 70 days. After ye 70 din, another 12 to 21 days are required for transport of sperms from the testis through the epididymis into the ejaculatory ducts. During the passage through the epididymis, the sperms mature and acquire the capacity for sustained motility, which is required for them to swim through the woman's reproductive tract to reach and fertilize the egg. The final stage of maturation of the sperms occurs after ejaculation into the female reproductive tract. This implies that the results of semen analysis we are seeing today reflect the conditions existing many weeks earlier, roughly the last 3 months. So if a man has had any illness, for example, let's say a viral infection such as dengue, chikungunya, COVID, influenza, if he has had toxic exposure in the environment, if he has smoked heavily or received treatments, for example, by chemotherapy medication or used anabolic steroids in the past 3 months, all of these factors will show their effects on the semen analysis done today. This whole process of formation and release of sperms is under the control of many hormones, such as LH and FSH released from the brain, that is the pituitary gland, and testosterone, among others, which are released from the testes. The evaluation of the man in a couple with delay or difficulty in conception begins with a basic history about the man's general health, medical diseases, any surgeries in the past, sexual history, any history of trauma, surgery, or injury to the sexual organs, and lifestyle assessment, especially exposure to tobacco, smoking, alcohol, drugs, or environmental toxins. An examination of the reproductive organs by an andrologist or a fertility specialist may be needed in some. A semen analysis is the cornerstone for evaluation of the male partner in fertility. Details about the procedure of semen analysis have been covered in our video on overview of fertility evaluation. The semen is analyzed in the laboratory and assessed against standard criteria laid down by the WHO, the World Health Organization, updated in 2010. Several parameters are assessed as follows. Number 1, the ejaculate volume and pH. The World Health Organization defines a normal volume of 1.5 ml or more and a normal pH for semen of 7.2 or more. A low or absent volume suggests the possibility of failed emission, incomplete collection or spillage, a short abstinence interval, or certain abnormalities of the reproductive tract or hormones. Other semen parameters and a discussion with the couple can point to the issues and their resolution. Number 2, the sperm concentration and total sperm count. The presence and number of sperms in the semen sample are analyzed. In 2010, WHO defined a minimum sperm concentration of more than or equal to 15 million per ml and a total sperm number of 39 million per ejaculate as normal. If the sperms are absent on standard microscopic examination of semen, it is termed as azoospermia. The sample is re-evaluated after centrifugation and repeated at least one more time after an interval of about 4 weeks before the diagnosis is confirmed. Semen contains sperms and secretions of glands such as the prostate and the seminal vesicles. Absence of sperms could be because of a blockage somewhere in the ductal system, which could be caused by infection, injury, or a birth defect, or because of hormonal disturbances or testicular disease. If the sperm count is severely low, that is less than 5 million per ml, then hormonal and genetic evaluation may be advised by the andrologist. Total sperm count is the product of semen volume and sperm concentration. So if the volume is low but the concentration is high, or if the volume is high and the concentration is low, the total sperm count may be normal, and this suggests a better semen quality than if both the parameters are low. The probability of conception increases with increasing sperm concentrations up to about 40 to 50 million per ml. Number 3, sperm motility. Sperm motility is defined as the percentage of total sperms that are exhibiting any movement. Arbitrarily, movement is graded as rapid forward movement, slow forward movement, non-progressive motility. At least 32% progressive forward motility is minimally required as per the WHO 2010 standards. 40% of total motile sperms is the minimum standard for normal motility in semen samples. The probability of conception rises with increasing motility up to approximately 60%. Poor sperm motility, also called as asthenospermia, may be seen in testicular dysfunction, genital infections, obstruction of the reproductive tract, or prolonged abstinence intervals. Depending on the cause diagnosed, treatment can be instituted or sperm movement abnormalities can be bypassed by modern assisted reproductive techniques. Details about these are discussed in the video on overview of modern fertility treatments. Sperm morphology. Sperm morphology refers to how normal the various parts of the sperm look as compared to predefined standards. The WHO reference values use strict Kruger or Teigerberg criteria to define normal-looking sperms. A minimum of 4% normal sperms are said to be indicative of a normal semen sample. Chances of conception continue to rise as the percentage of normal sperms rises, and highest pregnancy rates are seen when the percentage of normal sperms is 14% or higher. Modern assisted reproductive techniques have been a boon to help couples where a high degree of abnormal-looking sperms are seen. Besides the semen analysis, certain blood tests including blood sugar levels, blood counts, infection screening, lipid profile, hormonal test, and an ultrasound may be requested by the doctor after a clinical evaluation. Some of the causes of reduced fertility in men are hormonal disturbances, which could be due to genetic defects, tumors, infiltrative diseases like sarcoidosis, exposure to drugs such as steroids, which could be prescribed medically or used otherwise, for instance, for bodybuilding, any long-standing illness, critical illness or injury, infections or obesity. Secondly, testicular disorders. These could be due to genetic defects, abnormal positioning of the testes, infections like tuberculosis, exposure to some drugs, alcohol, radiation, environmental toxins, and chronic illness like cancer, liver failure, kidney failure, etc. Thirdly, disorders of sperm transport. These include obstruction in the path of transfer of sperms. This could be a formation defect by birth or a blockage due to infections, previous surgery, or an ejaculatory dysfunction. If a basic semen analysis is normal and there is no sexual dysfunction or an obvious medical or environmental issue, then largely it can be concluded that the male partner is all right from the fertility standpoint. If the semen analysis is abnormal despite repeated testing, then additional specialized testing may be required to reach the diagnosis. Based on the diagnosis, medical or surgical treatment may be offered, or modern assisted reproductive techniques can be used to assist the couple in conceiving a healthy pregnancy.